Because life has no reset button, think safety.
So the Institute of Immunology at the National Public Health Laboratory in Luxembourg has created a rapid response team against avian influenza. And this team has been created a year and a half ago to be deployed in countries that are resource poor and can otherwise not cope with the occurrence of avian influenza. I think that is fair to say, because African countries are traditionally resource poor, and it's very difficult for them without the international support to cope with the occurrence of avian influenza. And I think we can see that in Egypt, in Indonesia, but also probably in Nigeria and in Burkina Faso, maybe Niger. It is very likely that avian influenza is already endemic or will become endemic in poultry. Well, normally we have contacts with a number of labs, the National Public Health Laboratories for the human side or the veterinary labs, and they have partially been, some of their staff have been trained in our laboratory already in the past, and so we have very good contacts with a number of African countries, including the ones that I have mentioned, but also with the Democratic Republic of the Congo, the Central African Republic, and so forth, and others. And so if these people now become confronted with avian influenza or some other viral infectious diseases, they may call on us, and remember that we have been supporting them in the past and asking us to help them fight against this particular outbreak.